let me invite our first speaker for the day, Dr. Prasanna Venkatesh, who will be speaking on infrastructure, manpower, technology, and other resources guidelines. Actually, he is a senior consultant and pediatric urologist, robotic and renal transplant surgeon, and managing director, NU Hospitals, Bengaluru. And Dr. Prasanna is one of the very first government university qualified pediatric urologists in India, and has established 5 nephrology and urology and dialysis centers. He has been part of the team that wrote the syllabus for fellowship in pediatric urology and Rajiv Gandhi University of Health Sciences, Karnataka, set up the first pediatric urology and pediatric nephrology joint services department in Bengaluru. And he has been instrumental in setting up bedwetting clinics. It's a pan-India project. He has 6 journal publications, and he is the author for 8-year book chapters and 2 textbook chapters on his to his credit. Welcome and over to you, sir.
Good evening. Thank you, Mr. Manickavasagam, and thank you, Dr. Prabhakar and CAHO, for giving me this opportunity. I bring warm greetings from NU Hospitals, Bengaluru. We are a specialty nephrology and urology hospitals, started way back in 1999. And one of the intentions of our institution is to make sure that quality nephrology and urology care is given to all those who require it throughout the country. The topic given to me today was on infrastructure, manpower, technology, and other resources. I'll first talk about infrastructure, then manpower, and then technology. Quite an interesting topic. So I don't have any disclosures. I'm not associated with any companies that manufacture dialysis equipment. But during my research, when presenting this topic, I did find a lot of interesting things which I thought I would share with all of you. And Dr. Prabhakar, my colleague and good friend, we are both urologists, but also have significant experience in setting up and running dialysis centers. So trust me, it's quite difficult, especially when you want to do it across multiple units and then try and maintain the required quality. So let me proceed with the infrastructure norms. This is just going to be an overbrief because in 15-20 minutes you can only cover that much. So most important is there is a list of legal requirements, especially when you wish to set up a standalone dialysis center. Otherwise, most of these legal requirements are generally covered within the hospital statutory requirements. I just thought I would list that out. I also heard that all the participants will be getting the presentation, and I thought that it will be helpful to them. And this is the continued list of legal requirements. I think India has one of the biggest lists of legal requirements when you want to run a hospital, but I guess we need to follow with the local law. The second is, I did look up for guidelines. We do have one very detailed guideline by the Director General of Health Services, Government of India. That's a good document, not very much in detail. And if anybody wishes, it's available. I mean, you can email me and I could send you that. But typically it has a lot of guidelines on exactly what we need to do in a dialysis center. And some of which I have listed here. I've just picked up the salient points. We need to have at least 6 square meters to accommodate 1 bed or couch. And we definitely need to have an isolation dialysis area for hepatitis B, plus minus HCV, depending upon the local hospital policy. And then the rest of the things I think are fairly routine. I did search for this because what happens is dialysis centers in our country come in all sizes and shapes, which is definitely required. But anyway, these are the minimum requirements with respect to space when you're planning for a dialysis center. So approximately 10 beds would require around 2,500 to 3,000 square feet, and then you can multiply it. One of the things that we don't take into consideration is having adequate storage area and having adequate area in the RO plant. Most of the time, the RO plant room becomes very small. So these are just some limits that is compulsorily required. Now, support services, extremely important. You need to have a good CSSD sterilization area if you are not associated in a hospital. And you need to have, as per the guidelines today, medical gas. You definitely need to have UPS and generator backup, because you're well aware what could happen if the electricity is switched off when the dialysis is on. You need to have adequate storage. I already spoke about it. And I would like to stress one point is that you need to have adequate IT support. Today we are in 2022, and towards the end of my presentation, I'll be bringing up a lot of technological developments that's happening in the dialysis space. It is preferable to have good LAN network. You need to have a network point next to every dialysis machine, because so much of it is going to eventually get onto the cloud. And don't forget all fire safety devices and equipment, right from sprinklers, smoke alarms, etc., and fire extinguishers. So these are some of the representative pictures which I thought I would share. I mean, we've all seen dialysis units, but while I'm speaking about infrastructure, I think you will need to speak to your architects and designers and make sure that those pipelines don't get exposed. So you can easily cover it with a panel here, what you can see. And you should have gas pipelines next to each bed, apart from your LAN network. And then the rest is, personal choice, depending upon where you're setting up the dialysis center. You could use cots, you could use couches, they could be air conditioned, only fan, etc., etc. But try and incorporate something very different. These are all from our different centers. So this is a center where in Shimoga, we thought that we will use natural sunlight. And you can see how brightly lit up that dialysis hall is. So already we are well aware that renal failure patients have a lot of psychological issues. Sunlight, or maybe you could have a garden outside with a glass facade facing it. So these are all the little things that you should also take into consideration, and that's a complete isolation dialysis setup. This is from one of our other hospitals. I put up this picture. Look at the flooring. The flooring needs to be something that can take up a lot of stress and traffic, because you're moving dialysis equipment, you're moving couches, you're moving wheelchairs, and some of the patients, you may actually shift them on a cot. So either you have whatever, hospital grade vinyl or epoxy, or if you're having tiles, make sure that they are of the reasonable quality. So this is an epoxy floor with couches, and these couches have approximately 16 positions where the patient can be comfortable. And what you see at the head end is actually bioclad. So this is silver impregnated ions with the PVC sheets, which are anti-infective in nature. This center is 6 years old, and we just took this photograph very recently. And it just doesn't show its age, and it's very easy to clean. So the choice of material that you actually use should be something that you can easily maintain. This is another unit where you can make it, in a semicircular fashion with the nursing center in the middle, so that the nurse or dialysis technician can actually have a look all around. And this is also epoxy flooring. This was a center that was built in 1987, one of the first in the state of Karnataka. And you can see that you can see all these windows. So when you open it, it overlooks to a garden. So these are all the design elements that you can actually think of when you bring that in. And this is another center of ours. One point which I would like to make when we are speaking about infrastructure is that we generally keep a room for washing, dialyzer, reprocessing machine, etc. But I think the time has come in India, we should move on to a single-use dialyzer. We were the first to start it in Bangalore around 7 years back. And I'm happy to say that today, approximately 130 centers in the country are using only single-use dialyzer. The biggest advantage of this is because everything else now has become disposable, blood tubings, your needle, etc., etc. Now, if you use single-use dialyzer, the chances of infection, the problems with reprocessing, etc., are significantly sorted out, and the number of times the patient would need to get admitted with an infective episode over a year or two becomes significantly lower, and therefore you will save cost. Though the cost of the dialysis may bump up by 200 or 250 rupees, but what happens is one single admission, the antibiotics itself may cost 7,000-8,000 rupees. So this is something that you all should try and incorporate. All over the world, majority of the countries are using single-use dialyzer, including in the African nations. So I would urge all of you who are here to at least seriously give this a thought. And once you start counseling the patients, then what happens is the acceptance for single-use dialyzer is quite high. All our centers have shifted to only single-use dialyzer. Some other points on the RO incoming pipeline. So we use the PEX pipeline. That's cross-linked polyethylene. And you can see that there here in the first picture. It bends very beautifully. You have corner guards. And what happens is the RO pipeline starts in the RO plant and ends in the RO plant. So it's one closed loop. And you have these connectors that are actually punctured in and taken out. I'll show you some other pictures. And your RO supply, your inlet and your drain also should be like this. So that what happens is you're typically avoiding a lot of contamination, and you're avoiding some spillage. You're avoiding chances of leakages within this RO system. Earlier, these pipes were very expensive. Now, not so, because they're being used significantly across the country. So that's about the PEX pipe. One of the important things about the PEX pipe is the diameter is smaller than your regular PVC pipes. The inner wall of the PEX pipe is coated with epoxy and it's very smooth. So the chances of bacterial adherence, fungi, whatever it is much lower in the PEX pipe. And because the diameter is constant throughout, the pressure is usually maintained well. So there are definite advantages of this. And the other thing is it's very flexible. So you don't have sharp corners. You actually take it in a very slow bend. So I asked them to remove this panel to take a picture, and then you can see how that actually comes. You can have a drain like you see on the right, but the preferable would be to have a drain with the connector, what you see in the center. These are all available in India. The point is, a lot of our dialysis centers are simply not using it. And I would also recommend for all dialysis centers which are there in hospitals to use, to have one or two of these facilities in the single rooms where, you can have patients who desire to have dialysis in privacy. You can also use them as post-transplant recovery, etc., etc. Wherever the RO pipeline is going, in that pathway, you can tap it and then take it. And these are some views of RO plant. Make sure that you have impermeable tiles on the walls and on the floor. Try and keep it clean. One of the other speakers is speaking in detail on the RO plant, so I will not get into that in detail. But in places where there is a lot of hard water, instead of putting the entire stress on the RO plant, I would recommend you pre-treat the water with your regular water softener plant. So that will bring down the TDS significantly, and then it will protect your RO membranes, because otherwise your RO plant maintenance and costs will become very high. So these are just all the ideas that I thought I would put forth. This is this is the dialysis in session. So make sure that you have the emergency cart that you see in the right side of the picture, and you can see, if you desire to, You can have televisions for every patient who's undergoing dialysis, and then they generally bring in their own headphones or Bluetooth and then connect to that. So these are all options that you could actually think of. Now, if you look at the competition landscape with respect to what are the dialysis machines that are available, surprisingly, there are only 6 machines that are currently being manufactured worldwide. All of you are very, very much aware. You have 2 from Germany, 1 from US, and 2 from Japan. That's Fresenius and B. Braun from Germany, Baxter from the US, Nipro and Nikiso from Japan. And recently, around 9-10 months back, Renelex, which is an Indian machine based in Bangalore, they have got the CE certification and the Indian authorities certification. So these are going to be very exciting times ahead. There are a lot of comparisons on what you use, etc. But the point is that the machine cost and the consumable cost is something that is very, very significant for recurrent costs. So this is something that you will really need to keep in mind when you are deciding on these machines. So this is about Renelex. I'm speaking about it because it's truly a proud moment that in India we are able to manufacture and take this up worldwide. I do have some other details. I will share that with you. But some of the advantages of the Renelex machine is that the machine itself is telenephrology enabled. A lot of data that is put out by the machine can get automatically captured into the software, where it can be sieved through by technicians or by nephrologists by exception. And certain other things like it can get interfaced with the EMR of that particular hospital. You can put in Aadhaar, and you have certain custom features for specific countries. Yeah. So that's about the infrastructure. Coming to manpower, again, there are certain guidelines, but definitely every dialysis center should be preferably supervised by a nephrologist, which would be very ideal, or at least by a physician who is certified or trained in the management of a dialysis center. And in certain centers, because our country is so large where that is not possible, then it should be with a trained dialysis technician. Each technician or nurse who is trained can take care of probably 3 machines at one time, not more than that. And they'll have to stagger the priming and starting the dialysis and turning it off depending upon the shifts. But most importantly, the last point, periodic skill enhancement, updation, refresher training, and with so much of technology and machines and equipment coming in, I think a constant training is something that is very much required. Coming to technology, I would be speaking about some things that we are using in our dialysis units and some that is there worldwide, which will eventually come up. So we have the Massimo patient safety net system because we've had some bitter experiences of death on bed, or what you call as DOB, when the dialysis is being done. The technician is thinking that the patient is sleeping and then the patient is already dead. So that doesn't happen very commonly, but it can happen. So that's why I was also suggesting make sure that you have enough LAN ports. One local area network port to connect to the machine, one to connect to a monitoring device, etc. So these are simple devices that are kept next to the dialysis bed. It's just a pulse oximeter and things like that. And then it is connected to this central monitor, like your ICU nursing station. And this alarms, when the heart rate is going down and so on and so forth. So over the last, I think 3 years, we've been able to pick up maybe around 7 to 8 near cardiac arrests and try to resuscitate them, though not all could be resuscitated. But the point is, this is something that we should also start incorporating. You could have a good appointment system, which is there online. You have apps now where the dialysis patients should be able to take an appointment. In the event they are late or we are late, we could communicate to them. So this is something that all the centers can look in. We have many of our centers with the Fresenius machine, and we were using this TDMS, Therapy Data Management System for dialysis. It's a software. So the patient comes in with a smart card, you weigh the patient, put in the pre-dialysis weight, and then at the exit, the post-dialysis weight. And a lot of the parameters gets picked up from the machine and gets fed into this TDMS software. The point is that nephrologists can look at this remotely, or the dialysis in charge technicians or doctors, and they can sieve through and monitor by exception rather than trying to go through the entire data. It's got alarms, it's got targets, it's got thresholds, and so on and so forth. Training for our technicians, we make sure that they get trained on the dummy arms. So we have a typical number of access successions that they should have, because we are well aware that AV fistula is the lifeline of a dialysis patient. So this is something that is fairly simple to do, and many centers can incorporate it. 10 years back, we started using the CCTV across the hospital to monitor hand hygiene. And this has worked quite well, where the ICN or one department looks at it in the other department. And then, see, it's not practical to look at it for 24 hours. So you pick 1 hour, 2 hours, go through it, look at the nurses, doctors, housekeeping, who is not doing the hand hygiene, and then you could talk to them. You can also see at the bottom in the nursing station, you can see the Massimo patient safety net monitoring systems monitor there. The nephrology information system, which is out by Renelex, I did go through it, and this is something that's quite exciting if we all eventually may end up using. So for administration in the dialysis unit, for automated patient and doctor scheduling and whatever the reports that they want, the management as such, you can integrate it with your HIS or HMIS, billing module, supply chain integration. And for the doctor, more importantly, you can remotely monitor it. You have a clinical data dashboard and custom reports. And so say you come the next day, and you can see if 40 patients have undergone dialysis yesterday, these are the 3 patients who had alarms. These are the 3 patients who had abnormal parameters. So if you can do something like that, then you can centrally monitor a whole lot of centers. So these are exciting times ahead with technology that's coming in. I did speak about all of these things, and it's only going to get more and more common. Yeah. We also have the online prescription module. Many dialysis patients, they are on a lot of drugs, 15, 20, 30 drugs. Most of them are also having associated medical problems. One problem which we identified is that there is no single doctor who's reconciling all their prescriptions and putting it together. So we put that into the electronic method, and once a month, the doctor has to certify this. So you have the drug-to-drug interaction module, especially with the nephrology patients. They're on so many drugs. And you also have the allergy modules. And eventually the prescription looks like this. This is from a nephrology patient. So as per the NMC guidelines or MCI guidelines, everything is actually covered. And from the patient perspective, what the patient takes in the morning, afternoon, and night is clearly spelled out with the pharmacological name and the brand name. We also use the central monitoring system in the hospital, where all the refrigerators are connected, so that you can monitor the temperature. Otherwise, if one of these refrigerators, something happens, then you're not able to check. Another important point is that we have so many statutory stuff that we need to renew. We have AMCs, CMCs. You can simply use Google Calendar and share with it, and then it will give you reminders, for whatever is due across departments, and then you can share it to appropriate people. So these are all technology tools that you can use to make your workflow in the dialysis unit much better. And you have this is also something that we use where feedback is taken every day from the dialysis patients. It's on a tab, and then there is an escalation matrix. So if anything is not going on well, then immediately the people who are supposed to be informed get an email, SMS. So you do your service recovery to the extent possible when the patient is there in the hospital. So that will make an enormous difference. I just have one video for 1 minute and then I'm done. This is again.
Renelex Health Systems Private Limited is proud to bring you the smart dialysis machine. Renelex RxT17 is a remote monitoring enabled hemodialysis machine. Developed as per ISO 13485 processes, Renelex RxT17 is India's first hemodialysis device awaiting CE certification. Renelex RxT17, when connected over the cloud to a secure server, nephrologists can remotely monitor the dialysis session as it happens. The application not only provides the key parameters of dialysis, but also sounds alarms to the nephrologist observing remotely. The Nephrology Information System software provides an interface to comprehensively manage a dialysis center. With an ability to manage appointments, administration, billing, supply chain, and generate customized reports, the RxT17 is an end-to-end renal care solution by Renelex.
So to sum up on technological advances, I would recommend that slowly everybody move over to single-use dialyzers, have some sort of a monitoring system for your patients continuously, and also slowly work on how you get all of this data to make a significant difference. What does the future hold? There is a lot of things that is happening in the dialysis space. On one extent, you have the artificial kidney that may definitely come up probably in 5 years or 10 years. But on the other aspect, you also have a lot of these equipment that is coming up, more emphasis on home dialysis, more emphasis on telenephrology, and more emphasis on data management. So thank you very much. Thank you, Dr. Prabhakar and CAHO for this opportunity. Thank you.
Thank you, sir. Really, that was an enlightening talk, and I hope cleared many of our doubts related to infra requirements and smart use of technology to setting up the dialysis center and make life easy. Thanks a lot, sir.